Going into freshman year, I was probably the same size as everyone. I didn't really consider it a big deal, but as you know, in high school, everyone just starts going through phases. They start getting bigger. So I started noticing a lot of my friends getting a lot bigger, and I'd always say, oh, I'll grow, I'll definitely catch up. And then years later, I just never caught up in terms of growing. I felt almost stagnant, every year I'd be like, oh, I'll grow an inch, I'll grow a couple inches, and then later along, oh, maybe I'm just having a late growth spurt. And then just in college, I guess I came to the realization that I wasn't going to grow.
Bone has regenerative ability, so when we cut a bone and we pull it apart slowly, new bone will grow in the gap. It heals by growing new bone, not fake stuff, not paste, not scar tissue. And bone lengthening is about taking advantage of the body's ability to regenerate bone. So that's the typical approach that we do for reconstructive surgery, for deformity correction, for limb length equalization surgery. So stature lengthening is bone lengthening or limb lengthening done on two limbs at the same time. Good morning. Hey, Sam.
Hey, Dr. Rozbruch, how are you?
Good to see you.
Good to see you as always.
How you feeling?
I'm feeling great. Feeling real good. At first, I was like, all right, you know what? I'm accepting it. That's what it is. When you're short, you're short. That's how something that you can't deal with, you can't change. So I was all right with it for a little bit, but then I don't know. I guess I started growing a little bit more self-conscious about it in college. After college, I came back home. I started working at an after school. I started working with kids. I almost felt like I was the same size as a lot of the kids that I was working with, especially middle schoolers and stuff. And it kind of brought me back to being when I was in middle school, getting my freshman year of high school. That's the size I was, and I wasn't going to grow. I came across this surgery, and I thought it was a very extreme thing. Because they had external fixators. There was a lot more about the surgery that seemed extreme years ago. But then again, as I got older after college, I researched it. So probably another 4 or 5 years later, I started to research it. And I realized that the surgery kind of changed, and it wasn't the external fixator anymore.
One of the biggest advances in recent limb lengthening reconstruction surgery has been the introduction of the internal lengthening implant, or the internal lengthening rod. And we started using that about 4 years ago. And that has really revolutionized and changed limb lengthening surgery dramatically. The outcomes we're getting are the same, but the process, the recovery for the patient, the experience for the patient is night and day, night and day. We're taking a process that used to be very painful, take a long time, very labor intensive, and we've really been able to streamline it to a point where people are usually off pain medication within a couple of weeks. Stiffness of the adjacent joints is really not something that we have to deal with anymore. We don't have to deal with pin sites and skin irritation, all those difficulties that patients were experiencing when they were using the external fixator.
Me understanding what was going on in my body was very key. I wanted to know how it was going to happen, what was going to happen, what I was going to expect, and Dr. Rozbruch was very open to being honest with me and telling me, look, it's not going to be an easy road. This is what you're going to have to do. This is how the procedure is going to be. And he walked me through it step by step by step by step till I was comfortable.
Mobility is a little tougher than doing it on one leg, because with one leg you get up, you walk with crutches, you use your strong leg to propel yourself, and little by little you can increase the weight and start doing more and more and more with the operated leg. With stature lengthening surgery, since both legs are being done at the same time, the ability to mobilize and really get up becomes much more difficult for patients. And furthermore, with stature lengthening surgery, we're doing big lengthenings. Our goal in most cases is to try to do 3 inches of length. So that's a relatively big lengthening. Usually when we're doing limb length equalization, the average lengthening may be an inch, inch and a half. But here we're really pushing the limits, and we're going for big lengthenings. But with this new advance, this new technology of the internal lengthening rod, it has made the process much, much easier. The preferred bone for stature lengthening and for simultaneous limb lengthening are the femurs, the thigh bones. And so what we'll do is we'll do osteotomies or osteoplasty of both femurs, and we will insert the internal lengthening rods, and we'll do that at the same setting. That surgery is done with an epidural anesthetic and usually takes about 3 hours, about an hour and a half each side. The blood loss is minimal and the incisions are minimal. And then what we usually do is wait 4 days, and after 4 days we start the lengthening process. In order to get 1 inch, it usually takes about a month, and the second inch takes 2 months, and the third inch takes 3 months. So we're usually done with the lengthening after 3 months, and we'll be able to get 3 inches. And then it takes about another month to 2 months. But in many cases I've been finding just another month until the bone is hard enough, consolidated enough, calcified enough that people can actually start walking on it. So we're usually getting people up and really walking after about 4 months. Now the first 4 months, I don't want you to have the impression that they're just lying in bed, because that's not the case at all. They're spending most of their time sitting in chairs, in a wheelchair. They are standing using an assistive device, usually a walker. And we do have people walking a few steps, 5 to 10 steps, so that they can transfer and get around their house and go to the bathroom and be engaged in sort of simple but daily activities. They're usually able to do that right away. So they have that degree of independence, but they're really not doing a lot of walking. And it takes about 4 months to get to the point where I can say, hey, listen, the bone looks good and it's healed enough and you can start walking on it.
From that meeting, he made me very confident that we could achieve what I wanted to achieve, which was to get some height growth. And at first, I knew I wasn't going to be able to get 6 inches that I was originally wanting. Like, that's a reach. But Dr. Rozbruch kind of calmed me down, and he told me that I can get my 3 inches.
Stature lengthening surgery has been somewhat of a controversial subject. We do it for patients who have short stature, who have deformities. We'll do it for patients with dwarfism who have extremely short stature. But there is another group of patients, and they're patients who we call people with constitutional short stature. And so the typical person that expresses interest in this procedure is usually a man, but not always. We've had some women patients, but it's usually a male who is in the bottom 5th percentile of height. So we're talking about people that are 5'5" and under. This is a group of intelligent, highly motivated individuals who are actually very normal and accomplished, who are very unhappy with their stature. It's something that bothers them.
There's something that we call height dysphoria. And height dysphoria is really about a dissatisfaction, a fundamental dissatisfaction with one's stature. Another piece of the equation is what we talk about in terms of intrinsic motivation. You know, someone who is generally happy in their lives. They have good friendships, they have healthy relationships. There's just this nagging sense that something about their stature is holding them back.
And so Sam immediately seemed to me like the kind of young man that was a perfect candidate, in the sense, totally normal, highly motivated, energetic person who has this one issue. This issue really, really bugs them.
I never felt that anyone was trying to ever attack me about being short. It was more the way that I felt about it. You know, like, I don't really care about other people and their thoughts and their opinions. But when I look into myself, I always felt like I was bigger. I always felt like I was a different person sometimes. And I felt like not growing physically almost stunted my growth mentally. So it was a big thing for me to grow physically. I felt like if I was to grow physically, I would be able to grow more as a person, as an individual.
It's really about improving their emotional and psychological well-being, rather than, well, I'll get a better job if I'm taller. I'll go out on more dates if I'm taller. That's less important from my vantage point. It's more about really the person's fundamental well-being.
I wanted to make sure that I was not going to operate on people who were psychologically unstable. And I also wanted to make sure that if I did this surgery for an individual, that it was going to have the intended effect, which is make them happier. I wanted to make sure that we didn't get into a situation where people were not going to be happy, or they were going to constantly be seeking more or additional height, and and sort of asking for what I thought were unreasonable things.
I often ask patients, if you can't do the surgery with Dr. Rozbruch, what are you going to do? I have some patients say, I will travel the world. I will spend my last dime to have this procedure. That is not somebody I think will derive benefit, because the expectations far and away outweigh what can reasonably be expected. One glaring factor that keeps it way from the line is somebody who either has had multiple cosmetic procedures or somebody who is planning to have multiple cosmetic procedures, because to my mind, it will never be enough.
I had a conversation in this room. I brought 6 of my friends in this room. We had a conversation, and it took probably 2 or 3 hours. A lot of us were in tears, and like, they were supportive. They were very scared for me. They didn't, and I think that their fear came from not having an understanding of the surgery like I had an understanding. But if you ask them now, like, they're happy that I went through it. That's another thing that this surgery really showed me, is like, the people that I need and the people that really love me are there.
What I have found is, in the properly selected person, this has a very, very significant impact on their lives. It accomplishes what we hope to accomplish. And that, so from a physical point of view, yeah, I take somebody who's 5'4" and I make them 5'7". But the impact is much more significant than that.
This isn't a surgery that you can just do if you're not physically and mentally ready for. This is something that you have to know what you're getting yourself into. And even I thought I knew what I was getting myself into. Even then, I didn't really know, but I was prepared for the rough road ahead of me, because I knew that it was a day in and day out battle. But in the long haul, it was definitely worth it.
To my mind, it's really about inhabiting one's body in the fullest way possible. And if there's a surgical procedure for the right patient that can ameliorate the psychological condition, then, assuming a person's done a lot of soul searching, done the research, understands the risks and benefits, understands the limitations, then, Dr. Rozbruch and I feel like we want to give that person the best shot at feeling as full as he or she can feel.
How's your activity level been?
I've been doing like everything I've been wanting to do, everything I thought I would be able to do. I've been playing basketball, I've been running a lot, swimming. It was kind of scary to have a date set for, you're going to break your legs on September 2nd. It's kind of like, but the way I looked at it was, I'm just going to heal from an injury. It's just another injury. I've healed from many, many injuries before. Take it one day at a time. As of right now, I'm very much healing. Slow but sure. It's a day-to-day process, but I'm definitely getting there.
So we did your surgery back in September.
Yeah.
So it's not quite a year, it's about 10 months now. For
Yeah.
stature lengthening surgery, my job is generally not really to improve functionality, but it's really just the body image aspect of things. So that's where I have to be certain and do my best to do no harm. And we have been able to do that. I mean, physically, we're able to accomplish the lengthening safely, effectively. We don't lose range of motion in the joints, we don't lose muscle tone, and people are really able to get back to a very, very high level of activity. The alignment looks wonderful. You got your muscle tone back nicely.
Yeah.
Turn this way. Good. Turn your back to me. Go up on your tiptoes. Great. Muscles look great. And turn the other way. That's great. Can you do a squat? Can you do a deep knee bend? That's better than me. Stature lengthening surgery is being done all over the world, and a lot of times patients, in an attempt to try to get it done in an economical fashion, will go to other parts of the world to have it done. And I have seen a number of patients over the years who come back with complications from surgeries done elsewhere. And so you got to know what you're doing. there are potential complications, which include infections of the bone, non-unions of the bone, deformities of the bone, contractures or stiffness of the joints. These are the things that come along with limb lengthening surgery. And you have to know how to prevent them, and you have to know how to recognize them, and you have to know how to deal with them and treat them should they occur. Because you can't leave them alone and let them develop into full-fledged complications. I've seen that in patients treated overseas, and we have had to fix that, and that becomes much more complicated. So pull your ankles up like that, great, and down. Great right ankle motion. Bend your knee, hip. I mean, you've got perfect normal mobility. Tighten up this muscle. Lift your leg up. Down. Tighten up this muscle. Lift your leg up. I mean, Sam, your recovery has been extraordinary. Your quads are back to normal. I'm sure they're going to keep getting better and stronger, but I can tell you that your muscle tone and your range of motion already is sort of better than the average person. And so I'm confident that you're going to keep getting better and stronger and stronger. This is the magnet in the rod. These are the little gears. And this entire thing, it represents the 8 centimeters of length that you got.
Oh, wow.
But look at the quality of this bone. This is fantastic. At this point, now 10 months later, aside from the physical part, how do you feel? What kind of impact has this had for you?
Psychologically, it's actually been a lot different than I expected. Like, it's been great. Like, I've been walking around and just, even in the first few days and weeks of walking around, like, I noticed my literal perspective changing on things, being able to grab things a little bit easier. And I used to think about it a lot more, just think about height in general. And now I think that also going through this kind of process and going through it all it made me a little bit more modest, and I'm definitely a lot more satisfied. And when I'm walking around, I feel great. I feel much taller. I notice it. My friends notice it, and it's awesome because also people don't notice it. Like when I'm back in the basketball court, people are like, "Oh, you didn't change a bit." I'm like, "I'm happy you think that way." Like that makes me feel great that they think that I'm in the same physical shape that I was before.
Right.
And mentally, I feel a lot better.
Right. Well, you're closer to the basket now. So
yeah, 100%. 100%. That was like the biggest day for me too, was just going out and being able to play basketball with my friends again. And they were just as happy for me. I find this group of patients to be a very gratifying group of patients to take care of, and I find that in many ways they're very, very similar, slightly different, but very similar to my overall limb deformity practice, which is taking care of patients with discrepancies and deformities and limb salvage surgery, because even those patients have a aesthetic and body image aspect. The next time we see each other is going to be for the rod removal. Yep.
We'll set that up, so we'll talk about that. But that'll be an in and out on the same day surgery.
That's awesome.
Small incisions, same small incisions we use to put the rods in.
Okay.
And you'll go home the same day, and you'll walk out of the hospital.
Can't wait for that day.
Okay. Sam, great seeing you.
Yeah.
Have a wonderful summer.
Enjoy
the job. My
Yeah.
pleasure. My pleasure.
Thanks.
Okay, take it easy. Say hi to your mom for me.
For sure.
Okay, bye-bye.